Reported cases of COVID-19 keep trending up in Ontario, and testing to track the spread of the virus continues to lag far behind. Now adding to that problem is new confusion over just who should be tested. Michael Serapio brings our coverage this hour with government messaging now under increased scrutiny. Michael.
Absolutely, Heather. As you mentioned, the numbers are not what the province wants it to be. So now the question is being asked, is government messaging being consistent enough? Is it being clear enough? Because we keep seeing instances where it is not. For example, yesterday we saw the government at odds with its own health officials signaling one thing, and then later in the day health officials coming in to clarify what they see as priorities. One of those issues being testing. Since Sunday, the Premier has said he wants anyone who feels like they need a test, symptomatic or not, to go get a test. He, in his briefing, he kept referring to hotspots in the province where people should go get tested, but he never specified where. We know Ontario's hardest hit regions are in Toronto, Peel region, just west of the city, and the county and region around the city of Windsor. The province has been tracking cases by postal code, but that's not being shared by health officials. Take a listen to the Premier.
You measure it by postal codes, and like I've mentioned, some areas are lighting up like a Christmas tree. We're really going to drive the testing, get people out where the hot spots are, get them tested. It's absolutely critical. I got to make sure we're fully ramped up. But I want as many people tested as possible, asymptomatic, symptomatic.
So again, while the Premier is referencing postal codes, that's not being shared by his own health officials, so it's not obvious who should be tested on where they live. And even when you look at the now infamous scenes out of Toronto's Trinity Bellwoods Park on Saturday, the Premier suggested that everyone who took part should now get tested, but health officials said they would rather those people self-monitor for 14 days. And even on the ground, those who do carry out the testing, they're actually not confident they can carry out the Premier's wishes. Take a listen.
May not have enough PPE or swabs for the people that are showing up. So it's the staff are not happy. We just don't have the capacity in a small site to ramp up. We need more space, more staffing, and those just can't turn on a dime.
So in all of this, at times confusing messaging, who should actually get tested, definitely get tested? Well, we put that question to infectious diseases specialist Dr. Isaac Bogosh from Toronto General Hospital. Take a listen to what he said.
Places like long-term care facilities, homeless shelters, refugee clinics, prisons. The goal is, testing asymptomatic individuals in those settings as really a surveillance system. And they will have to figure this out moving forward about what's an acceptable frequency of diagnostic testing, because a surveillance program isn't just a one-and-done program. You have to make sure that there's a regular interval of diagnostic testing in those settings. And because the virus can be introduced at any time along the road.
Dr. Bogosh giving us the perspective on why it's necessary to get a handle on all of this, Michael, and target those particular populations. The problems that Ontario is encountering, the fact that the numbers continue to go up, people in the province may find that the restrictions are not easing anytime soon.
That's right. The trend lines are not very good so far for the province when it comes to testing, as well as the number of new cases. And then you see, once again, what happened Saturday in Toronto at that park. And all that apparently is giving a reason for Ontario's chief medical officer to pause. He is now pushing back on this idea of increasing one's social circle. So if anyone in the province of Ontario was hoping that we would follow the lead of other provinces that have now doubled the number of people you can spend time with, well, that may not be happening anytime soon. Take a listen to the Ontario Health Minister.
What has happened over this past weekend with large groups of people coming together in Trinity Bellwoods and other parks, Dr. Williams is reluctant to move forward with that right away because there is a concern about people creating groups that are too large. So it is something that will be coming forward, but it has been pushed back a little bit.
So what does that mean? People in Ontario know ever since March the 28th, groups have been limited to no more larger than 5 unless a household happens to be larger than 5. And again, if anyone's hoping that the numbers might increase, that they might see some more of their friends and loved ones, well, that's not going to be changing, at least for now, Heather.
Michael, thank you very much.
You're welcome.
Michael Serapio.